we're finding is, again, what you talk about is issues of not having enough muscle mass. And that becomes a huge problem
Hmm.
at any age, but especially as we get older. The risk for falls after the age of 65 goes up pretty much exponentially. And so, we're talking more about sarcopenia, right? Low muscle mass. We're talking more about the dangers of not having that. And then, as you also mentioned, having poor cardiovascular fitness. If we don't have good muscle mass and if we don't have good cardiovascular fitness, our risk for everything goes up.
Right.
And aerobic training and strength training actually decreases that risk. So there's a great article authored by Sue Phillips. It's called "The Coming Age of Resistance Exercise" as a primary marker of health or something like that. But it looks at uh, decrease in risk if you do aerobic alone, if you do strength training alone, and then combined. And the effects are synergistic, such that like combined they have a bigger effect than
Either of them alone. Yeah. Yeah. Yeah.
exactly. And so really profound. And so that leads us to what you said earlier is sometimes people that are overweight have more muscle mass, but it's not always the healthiest muscle. And so having a high quality of muscle becomes really important for staying healthy, for staying active and warding off a lot of the diseases of age.